This is a presentation about past and present health promotion techniques used by the government and local NHS services to help deal with ongoing health issues in society. In this presentation, I'll be exploring more about these health initiatives and how they guide people to lead a healthier lifestyle by giving incentives to stop smoking and eat healthier. After these health initiatives were released, there were significant changes in the numbers of people who started eating healthier and stopped smoking due to taking part. This has led to more health-based initiatives being released by the government based on promoting and improving the health of the general public. There are many reasons why these initiatives are being introduced by the NHS and the government. These include the need to reduce the burden that poor health and lifestyle choices has on the NHS and the expenses required to treat illnesses that can develop due to ill health. Change for Life is the first health promotion I'm going to talk about. Change for Life was first introduced in January of 2009 when it was brought to the attention of the Department of Health that in the UK the numbers of obese people had trebled since the 1980s. It was said that if this way of life for people continued, it would mean that by 2050 only 1 in 10 adults would be of a healthy weight. This increase in obesity would put a huge strain on the National Health Service and wider costs in society. High levels of obesity can cause massive strain on the NHS and it is therefore important that rates of obesity are managed and controlled. Many people struggle with sticking to a diet and exercising regime. However, the idea behind Change for Life was to introduce easy and simpler ways for people to make changes to their lives that would cause them to lose weight and become more active and therefore healthier in the longer term. The idea behind Change for Life was that the government would make plans for promotion of healthier eating in schools for children, introducing more outdoor areas and safe places for children and families to play and exercise, and building more cycle lanes to make cycling more accessible and easier to use day to day. The focus on introducing these changes to young people in schools was designed to have a greater impact. This is because if healthier habits can be implemented in earlier age, then they are more likely to be carried through into adulthood. This would then cause the next generation to be more active and therefore healthier than the generation before. Also, if children become more active, then it could have a positive impact on their parents, who may also take part in sports and activities with their children. The idea that the whole family could all make positive changes was crucial to this initiative. This is shown through the TV ads that show a whole family working together. These small changes to daily life help the families to follow the tips and ideas to become more active and eat healthier. The benefits of this would be to decrease the strain on the NHS and decrease public spending on the treatment of conditions that are linked to obesity and poor health. Change for Life started putting out adverts and posters to get families' attention. They used lots of simple posters and fun, colourful adverts to make the idea fun and stick in people's heads. They used easy, quick titles and fun activities and things for families to think about in day-to-day situations, such as how they get to school and what kind of snacks they'll get eaten, and whether these could be swapped for something healthier. This again links to the idea that people struggle to make changes to their lives because they usually choose to make big changes at a time, which are normally difficult to stick to long term. If small changes are suggested to people, then they don't have to think about what they should be doing, and also they are more likely to stick to these changes as they are only a little different from their normal routines. Change for Life released lots of resources for families and for schools to get involved and learn about simple swaps to make healthier choices in life. These included teaching resources and simple lessons for teachers to do in school with children, such as learning what is healthy and unhealthy for us to eat. They also released family snack challenges to help families make small changes to a healthier lifestyle. All these small changes help families to be more mindful about what they decide to eat or do to help lead a healthier life. This is linked to the idea that if people are educated on their choices, then they can make better choices that will therefore benefit them in the future. If children grow up with the knowledge of how to maintain a balanced diet, then they will be able to develop into adults with this healthier relationship with food. The aspect that links the family together as one unit increases the chance of success, as it gives a level of accountability to everyone in the household, as the challenges allow everyone to work together. The result of Change for Life campaign. Change for Life exceeded all of its first year targets, including reaching 99% of targeted families. Over 400,000 families joined Change for Life in the first 12 months. Over 44,000 families were believed to still be involved with Change for Life after 6 months. over 1.9 million responses in 1 year. 44% of primary schools, hospitals, general practices, towns and village halls, children's centres, pharmacies, nurseries, libraries and leisure centres displayed Change for Life materials. Over 25,000 local supporters used Change for Life materials to help them start conversations regarding lifestyles with over 1 million people. NHS staff ordered over 6 million items of Change for Life material to distribute to the public. Primary schools generated over 50,000 sign-ups to Change for Life. In 2021, the Change for Life campaign joined with the Better Health Initiative after a huge influence on children and families to lead healthier lifestyles. The Better Health Initiative not only looks at eating and exercising to be healthier, but also helps give ideas and tips for adults to drink less and to help stop smoking, in the hope that this will give them support for more people to become less dependent on these things, to make them happier and contribute to living a healthier lifestyle and therefore live long and happy lives. Change for Life was very successful as it brought families together with a common goal of improving the physical health of every member. This campaign will have reduced the strain on the health service and enabled families to lead more active and therefore fulfilled lives. The next health promotion I'll be talking about is Stoptober. Stoptober is a Public Health England campaign introduced in 2012, an initiative to encourage adults to stop smoking for 28 days in October. Statistics say that if someone can quit smoking for 28 days, they are 5 times more likely to quit fully. Smoking cigarettes is a habit that puts a huge strain on the NHS, as it is directly responsible for health conditions such as lung cancer. The habit of smoking is very hard to break. This is due to the highly addictive chemical which is found in cigarettes called nicotine. Stoptober allows access to resources and communities for people taking part to get involved in, to share ideas and struggles to help them through the Stoptober process. How Stoptober works. People wanting to take part in the Stoptober sign up to the Stoptober website, where they are given access to a range of free quitting tools, including the NHS Quit Smoking app, Facebook online communities, daily emails and messages to keep encouraging you to carry on, online personal quit plans, as well as advice on stop smoking aids, vaping to quit smoking. There is a real focus on the idea of forming a community of people who are all working together to achieve the same goal. This is actioned by using the community and Facebook groups. These are places where people can share their experiences and feel like there are lots of other people going through the same problems at the same time. This promotes a level of accountability where people don't want to be the first to quit or feel like they have let others down. There is also encouragement to find support from family and friends, as this is very important when quitting smoking, and these networks can be vital to assist a smoker when they break up with smoking. Providing alternatives to smoking is crucial to breaking the habit. The resources that have been put into providing vaping kits for smokers has been vast. However, it allows smokers to have a small amount of nicotine without smoking a cigarette. Results of Stoptober. The first Stoptober campaign in 2012 boosted the chances of quitting smoking in October by 80%, resulting in 350,000 stop attempts. Over the next 5 years, a similar pattern emerged, with quit attempts being more common in October than in other months. People often express a desire to stop smoking. However, the idea that it is synchronised means that they have a specific start date for the attempt to quit. This means that people don't put off the start date and have set calendars to stick to. Stoptober gives people the confidence and tools they need to take further steps towards a smoke-free life, and therefore enables people that take on the challenge to quit fully and spread awareness of Stoptober campaign and information. The success stories of other people who manage to quit will then inspire others to see if they can follow the same programme. Then they can also manage to quit. The idea that it seems so difficult to stop smoking will put many people off from trying to quit in the first place. Seeing success means that more people are likely to attempt to stop. Since Stoptober began, it has helped around 1.9 million people to stop smoking from completing the Stoptober challenge. This huge number has saved millions of pounds which would have been spent by the government to treat illnesses of people that are linked to smoking, and improved and prolonged the lives of millions of people to the benefit of them and their families. My health promotion idea is Christmas cut down. The idea behind this health promotion is for adults to cut down the amount they are drinking over the Christmas period. I have chosen this time of year as the festivities that take place during this period usually involve alcohol. There are also many points during this time of year where drinking excessively is very common. This includes days like Christmas Eve, New Year's Eve, and work parties. Studies have revealed that during the Christmas period, adults will consume on average 26 units per day. And in the whole Christmas period, from Christmas Eve to New Year's Day, the nation will collectively drink 6 billion units of alcohol. This is over double the recommended weekly intake of alcohol that is recommended for adults. This figure is also an average, which means that many people are drinking more units of alcohol than this, and that people who do not drink at all are potentially bringing these averages down. It is likely that for many young people, these numbers are closer to 30 units. Reasons for this health initiative. Doctors recommend that adults do not drink more than 14 units a week. This is the equivalent to 6 pints of beer. They also recommend that people should space out their drinking and not save the units and have them all in one day. At Christmas time, with alcohol consumption increasing by over 40%, this also means that people are risking driving whilst over the legal limit. This means there is a much higher risk of car accidents happening. High anxiety and stress over the Christmas period can cause people who suffer with bad mental health to drink more. People who are prescribed antidepressants are urged by doctors not to drink, as alcohol is a depressant, and this could cause depression to become more severe. Drinking large amounts of alcohol can contribute to health problems such as obesity, heart disease, and some cancers. Having these kinds of health problems can limit life expectancy. Christmas cut down will be advertised on television and on posters in doctors' surgeries and in supermarkets to get people thinking about how much alcohol they are consuming over the Christmas period. I have chosen to advertise on TV because of the high number of alcohol commercials that are shown during the Christmas period. There are often large multi-pack offers of beer advertised by supermarkets, with the offers on spirits also shown frequently. The idea is to make sure that people are aware that they can enjoy Christmas period without the need to binge drink, and this message will be conveyed alongside these adverts for cheap alcohol. I have chosen to advertise in supermarkets for a similar reason. I would like to place simple adverts highlighting the dangers of drink driving and dangers of health on the aisle that alcohol is sold. These are not to prevent people buying alcohol, they are just to highlight the risks that are involved. The posters in doctor surgeries will focus more on the health problems that drinking heavily can cause. These will include both short and long-term conditions, including alcohol poisoning and liver damage, respectively. These will contain effects of high consumption of alcohol in the body and how Christmas can be a happy time without having to consume alcohol. The idea behind Christmas Cut Down is to help guide people to being more mindful about how much they are drinking during this period. This will enable them to spend quality time with their families and contribute to better mental and physical health and well-being. Often, when people drink heavily, this can lead to poor decision-making. This can therefore snowball into many things that can impact the lives of people, including examples such as drink driving or falling and becoming injured. Both could have huge negative repercussions on a person's life. These also put a demand on the public health service, which must be funded by the government. There is also a huge health aspect to this promotion. The idea behind the Christmas Cut Down is to decrease the amount of alcohol that is consumed to a steady level, and for this to be continued throughout the next few weeks and months, with the hope of a better relationship with alcohol being established. This will therefore promote better health within adult population and directly decrease alcohol-related conditions, including liver problems, heart disease, and high blood pressure. This will allow people to lead longer and more fulfilling lives and decrease the strain on the health service.